What's your history with CV247?
I did locum work for Mr. Carter's surgery when he wasn't available on a regular basis, whilst I was also working for cancer research for the past 40 years. I found that some patients came who were bringing animals with neoplastic conditions, and Mr. Carter administered this drug, and they were very enthusiastic about the result, and they kept coming quite regularly for treatment. Mr. Carter asked me to comment on these cases, and I studied 26 of his cases, and I was very impressed by the rapid improvement these animals exhibited after commencing the treatment. Out of the 26, in fact, 24 showed this improvement. There were some cases where the actual neoplastic condition seemed to have subsided or showed some kind of control. In fact, in some cases, regression was quite evident. But I insisted that all these cases should have histological proof that the tumor was really a cancerous or neoplastic nature, for which either histology or some other means like X-ray and a very thought out opinion would have proven that it is neoplastic.
So what would you say is your experience of the effects of CV247 as a treatment?
Well, it certainly helps the veterinary surgeon making some kind of improvement in the condition of the animal affected. These animals are usually coming with a grave prognosis. They have to be dealt with so that there is no suffering involved. And of course the obvious answer in many cases is euthanasia. But there are owners who don't want at that time to decide. They would like to try something. At the same time, they don't want any conventional chemotherapy or radiotherapy, because of the side effects are quite devastating in humans as well as in animals. And in animals, once you have the side effects, you think, well, it is suffering, you have to put it down. So these drugs seem to have been quite a godsend for this kind of situation because of the great improvement. It also gave a longer lease of life, which may have helped in the regression rather than actual disappearance in some cases of malignancy, which probably wouldn't have not been known if the animal was euthanized at the outset. But I wouldn't like to call this drug as a therapy for cancer. It is a therapy for cancer patients which give sufficient improvement in the condition to carry on in a dignified way, either possibly some resolution or eventual euthanasia.